Hi, I'm Dr. Jenn Kennedy, and I am a sex therapist, and I am here to talk to you a little bit about your sex life, like your general level of satisfaction, what you know about your own desires. It's interesting, I'm a sex therapist, and so people bring all kinds of things to me, typically more in the camp of dissatisfaction, which is I don't like the sex I'm having. It's kind of like take it or leave it, or it generally isn't that satisfactory and I don't know how to talk to my partner about it. Or sometimes it's also I don't even know what I like. I've never actually had good sex. I have clients that come in that have never had an orgasm. So it's interesting because there's just a wide range of presentations that are possible. And when you finally start to unpack it with somebody, when you feel enough safety to actually say, hey, this is what's going on for me and it's a bummer and I want it to be different, then we start to unpack it, right? It's like I can say, it's like a whole decision tree. When you tell me something is occurring, then I say, okay, does it always happen? Is there a time when it didn't happen? What are the circumstances around it? Because context really matters. But then also, what can change it, right? We start to look at maybe possible interventions or possible ways to help you try something different. Think about it differently. I feel like a lot of times with sexuality, people just sort of retreat. They feel some shame, they feel some frustration, they feel they feel like something's wrong with them, and so they just kind of give up. They don't actually seek the help. They don't actually unpack it with somebody. Now, they might go to their primary care and say if something's really like hurting or itching or burning or painful, they might unload that. But satisfaction is sort of like this negotiable that we've sort of reconciled in our culture. And I want to push back on that a little bit because I do actually feel like not that we all have to have like amazing sex all the time, but it's like generally I think we are entitled to a really good sex life. And so what would that mean for you? Like what would be happening differently if it were better? And sometimes it's a matter of like we don't know what we've never known, right? You can't describe a color you've never seen, but you might have a general sense, or maybe you've had a partner in the past where it was so much better and you're like, I want that version. So that's kind of the interesting road that we travel. I taught human sexuality even at the graduate level, right? These are therapists that are preparing, they're students that are preparing to be therapists. And there is a lot of hesitation, trepidation talking about sex, which I find so interesting, right? We're marriage and family therapists, and yet there's a lot of like fear and hesitation talking about sex. So imagine the everyday person that's like also trying to negotiate their sex life without all that language and without all that theory and skill of talking about feelings and needs and that type of thing. So getting people to actually like unpack what is their personal experience, what are their challenges, what would they like to be different, what could they imagine to be different, and then really kind of sorting out what helps, what doesn't help, what influences where they currently are. That's the process of sex therapy. Now, in addition to teaching, I also did a PhD in sexology, which is literally just everything related to sex that you can imagine. That's looking at it historically, that's looking at it physiologically, relationally, like all the pieces of it. And trying to understand, because people walking in the door might have multiple things going on, right? It might be biological. I've talked about this before. It might be psychological, kind of what's going on for them in their mind. And then it also might be interpersonal. If you've got a partner, likely you're negotiating that too. So there's lots of variables that could be happening, and there could be multiple things happening for you. So starting to kind of unpack that and get your arms around what is happening, how do I feel about it, what influences it, what makes it better, that's the work that we do together. Now that's therapy. The other option, which I've started to really move toward, and I love this so much, is group work, because I can say certain things, but it takes a long time sometimes for people to get their arms around it. Whereas when they're in a group of people that are having similar issues, they can hear it reflected. They can sometimes even identify it when someone else is having a similar experience that they didn't even recognize as their own. So I've developed this curriculum called the Pleasure Circle, and it's a 6-week program. And basically each week I give a mini lecture. So people, and currently it's online for women. I'm also going to do a version for couples. But each week people log on and I've got a little mini lecture prepared, and it's a small group, like 6, 8, 10 people max. They're listening to the lecture. And the lecture's, it's about sexuality. It's totally related to everyone's experience. And then I give you writing prompts and have you start to kind of deepen it, right? Like, how does this show up in my life? Like week 1, for example, we look at history, like all the main things that affect women's sexuality or people in general sexuality. Actually, it could be for either, for the couple's purposes. Things like culture, things like religiosity, body image, those types of things. So we really start to unpack those elements that affect you. And you do that through writing. I'm going to ask you to write about these things. And then we talk about it. We as a group start to process it. And you start to get some insight and some understanding, which then leads to some relief, because you're like, oh, this is once you know what it is, once you understand what these are the things that are getting in my way. These are the obstacles, right? And it's different if it's biological. You might need to go see a physician for that, right? An MD. But most of the time, what I'm dealing with is not. It's not physiological. It's something else. It's something that's more in your mind. It's something in your relational dynamic. So we start to figure that out for you, with you. The pleasure circle is 6 weeks. Magic happens during that time because the group coalesces. They really start to get deep understanding, and it's this transformation can happen pretty quickly. So I'm excited for it. I'm actually starting up another group soon. I would love for you to be a part of that. So depending on where we are and when you're watching this video, you can either join the next group or put yourself on the wait list for a future group. You can find me at pleasureproject.us, and there's a join the waitlist form there. So please reach out. Would love for you to be a part of it. If you want to understand more of exactly kind of how it lays out and what we do, then join us. Then just reach out to me, and I'm happy to give you that information. But I really think that this can make a difference for you. And the goal being not to have a perfect sex life. I mean, gosh, that would be so nice, right? But to improve it, to just have general satisfaction and pleasure in your life, because I think you deserve that. I think we all do. And I think that there's, it's easy when we're young to just sort of tap into that. But as we get older, it starts to feel harder to access it. And we don't understand why. And so then it becomes this sort of like piling on of, I'm just going to back away from it. I'm not going to deal with it. And then it's like, I do these intakes when couples come in. And one of the questions I ask is, how frequently are you having sex? And how satisfied are you with the sex? Because just because you're having sex often doesn't mean it's good. And just because you're not having sex very often doesn't mean it's bad. But I want to hear, first of all, how frequently, and how do you even define sex? And secondly, how satisfying is it? Like, do you like it? And if you don't like it, or if you could like it more, let's talk about it. So anyway, thank you for tuning in. And there's lots of other videos on similar topics. So if you're interested in the Pleasure Circle, reach out to me soon. And that's at pleasureproject.us. And I look forward to speaking with you.